Hello, welcome back to Informal Training Solution. So I'll be discussing briefly anesthetic agents, of course briefly. Of course we know that anesthesia enables the patient to tolerate surgical procedure, and the anesthetic state includes unconsciousness, of course analgesia and amnesia. I'm sure always you are aware that we don't know what has taken place. Inhibition or attenuation of autonomic reflexes. Immobility, of course, you have immobility. Even though they prick you, you cannot move. Now, and sometimes skeletal muscle relaxation. Now, which are the effects of general anesthesia? Of course, we know have general anesthesia and local anesthesia. Now, we have in the CVS, of course, they decrease the systemic arterial blood pressure through direct vasodilation. Now, in respiratory system, of course, we know that they eliminate both ventilatory drive and reflexes that maintain the airway patterns. That's why when you are in surgery, we maintain your in your breathing or your airway artificially using those machines. Also, the general anesthetic agent, they trigger the chemotrigger zone or the nausea and vomiting in the brainstem. Hence, we use drugs to prevent nausea and vomiting. That's like droperidol, metoclopramide, and dexamethasone. All these ones could be used to prevent this in adjunct in pre-anesthetic medication. Which are those general anesthetic agents that we use? Of course, we have the parenteral ones. They are the most common drugs which are used in induction or anesthesia. These are used in induction because they are highly lipid soluble. Remember, all these ones are short presentations. Short presentation in anesthetic agents. We have propofol. Of course, it acts on the GABA receptors. By acting on GABA receptors, what are we meaning? We are increasing the inhibitory effects of GABA through opening of the chloride channels. Now, of course, it's used in procedures where they will require rapid return to pre-operative mental status. And also we have propofol. Etomidate, usually used reserved for patients in high-risk hypertension and myocardial ischemia. Ketamine is best suited for patients with asthma or children undergoing short painful procedures. Now, the others which we talked about in barbiturates, we talked about thiopental and methotrexate. All these ones are GABA analog, or they are GABA analogs, and they increase the effects of GABA. But these days they are rarely used. But thiopental and methotrexate is also available to be used parenterally as general anesthesia, mostly used in induction anesthesia. Now, however, for maintenance of anesthesia, we usually, I'm sure they use the inhalation anesthetics. Now, these ones, they act through activation of the potassium channels or the two power domain channels, the K2P, located in the presynaptic and postsynaptic sites, which lead to entry of potassium ions, hence hyperpolarization. Are you getting it? Hence hyperpolarization. Remember, when you have hyperpolarization, there is no way you can generate an action potential. And remember, we need an action potential to transmit the pain stimuli for interpretation in the brain. But now here we are diminishing the action potential, hence we cannot feel the pain. Now, which are those inhalation anesthetics which we have in pharmacies? We have enflurane, isoflurane, halothane, dexflurane, sevoflurane. These are used for maintenance of anesthesia after induction with other agents. Now, the adjuncts which are used in this general anesthesia prior to inhalation, we are having opioids, as I explained earlier, in opioid and nitrous oxide. This one could be used to reduce the concentration of inhalation anesthetics, or what we call the halogenated inhalation anesthetics, such as isoflurane, required for surgical anesthesia, surgical procedure. Now, let us explain the The adjuncts briefly, we have the benzodiazepine because they're used for their sedation. Midazolam, diazepam, lorazepam could be used. For analgesic, we can use opioids such as fentanyl, sulfentanyl, alfentanyl, meperidine, morphine. Can be used, but it is not good to use morphine. You can use these other ones because they are stronger analgesics. Now, because morphine, we know the effects of morphine. Now, of course, you can also have the neuromuscular blocker, succinylcholine, or the vecuronium. Because these they use to relax. These are muscle relaxant often administered during induction of anesthesia to relax muscles of the jaw and the neck and the air to facilitate laryngoscopy or endotracheal intubation. This one. Succinylcholine, I'm sure we are going to talk about them when I reach. These ones are found in, I think, anticholinergics. Somewhere there, neuromuscular blockers. We shall look at them in details. So these ones are used to relax the jaw muscle to facilitate laryngoscopy and endotracheal intubation. As always, remember these are short presentations. Now we have local anesthesia. Because this is the temporary loss of sensation of pain in a part of the body. Then these are usually applied topically. Now they reversibly bind and inactivate or block the voltage gated sodium channels, hence inhibit duration of action potential and thereby inhibit excitation of the nerve endings or the conduction in the peripheral nerves. Now, the component which is used is lidocaine. However, lidocaine is used together with epinephrine. Why epinephrine? Because epinephrine, it will cause vasoconstriction of the vessels, hence trapping lidocaine at the site of action or site of application. And of course, this one will increase the duration of action of lidocaine, hence more hence the local anesthetic agent. And the local anesthesia. Now, bupivacaine, all these ones are used. I'm sure, I don't know, bupivacaine is used, it's applied in the spinal cord, maybe. So all these ones could be used. There is also cocaine, which was used before. Cocaine, I've left it out. Now, of course, these are the local anesthesia could be used in simple surgical procedures, and also they are mostly applied in tooth extraction. The side effects, I'm not looking at them so much because these are short presentation. These are the other presentation which we have in CNS pharmacology. Always refer to them. I always remain Wilson from M Pharma Training Solutions. Like the video, leave a comment on how you can improve. Contact us for more information. That's our WhatsApp number. And thank you very much.